Hi, my name is Kevin Wilhelm, President and CEO for Middlesex United Way, and we are involved with the 38 very best nonprofits in Middlesex County, and St. Vincent de Paul is one of those, so I'm really happy to be here to help participate in their 8 Days of Giving. With Middlesex United Way and the 38 organizations that we provide financial and volunteer resources to, it works best when it's a partnership. And I think for most of the relationships, it works that way, it's certainly including St. Vincent de Paul. How do we leverage the strengths of each of our organizations to improve lives and make a better community? That is what drives me. That's why I get excited to come to work every day.
When it comes to tackling a big problem like making sure that our seniors have nutritious food, it's not something that you can put on the city alone. It's not something you can put on St. Vincent's alone or any nonprofit. It's not something that you can just put on Stop and Shop and expect them to even have the ability or the knowledge or the resources to do that on their own. But as you were saying, when everybody is playing their role, things happen smoothly. So if the city can't do one component of this on its own, if they say we come up with our plan for delivering groceries, if we don't have a St. Vincent's to pick up the phone and reach out to actually help us make it happen, then it doesn't happen, and then it's an idea that just sort of dies on the vine.
Well, that's part of the community, the health enhancement community that's coming together and really looking at what resources are in the community, and then being able to make sure we're aware of those resources, but also at the same time, how do we together make Middletown more healthy? How do we nutritionally stay healthy? How do we emotionally stay healthy? How do our kids stay healthy, even though they've experienced various kinds of things? And this whole thing with this pandemic was traumatic for everybody. And so how do we survive with that? What kinds of things do we need to bring into our community to make sure that we're taking care of our community and keeping our community healthy?
Well, I think that the whole concept of social determinants of health, the concept that people's health is affected by where they live, how they live. I think our community care team is one example of how what we're really getting at there is identifying the social issues that are affecting people's health and affecting how they utilize the healthcare system. And we're looking to try to expand ways in which we can get at social determinants of health and connect with community partners that can help to address the specific needs that people have, whether it's a lack of food, a lack of housing. There are all sorts of issues that people are having in this community and in other communities, and we're trying to work collaboratively, so collaboratively with as many organizations as possible.
We actually realized that Middlesex United Way was involved with both funding food programs at the Red Cross and the Salvation Army, and that St. Vincent was obviously involved in providing food to people in need. And we thought, man, we're already funding these two organizations. Let's bring the three organizations together to see if we can make this better, because our understanding was that each organization at that time was open 1 or 2 days a week, different people going to different organizations, and what they were getting was very modest. So it took almost 2 years, but we met monthly for 2 years, and eventually Amazing Grace was born as a collaboration with those organizations. But it became clear once Amazing Grace was born, with United Way now funding through St. Vincent de Paul, so we're providing funding for the first time. Now more people are being served more effectively and more efficiently, all through one organization, which was the point 15 years ago as we got involved. And people kind of don't know that story.
What I really appreciate about the new direction that St. Vincent's is taking is the focus on all basic needs. The fact that there's recognition that if you help somebody with their nutrition needs, that takes the burden a little bit off of meeting their other needs, but those needs are still going to exist. The addition of a program to help provide clothing, I think, really speaks to that mission and the commitment to finding the actual needs and meeting those needs where they are, whether it's with specific communities or specific individuals that you're serving.
We also have a project called How Can We Help? and that is actually serving people in the community that are using substances. We have 2 recovery coaches that work, coaching them, helping them to establish independent living, make sure they're connected to entitlements, things that they really are supposed to have. Also taking them to medical appointments, helping them kind of navigate systems if they look like they really need a higher level of quick care and they need to get off the street. They help them get into treatment, and then they also are there when they come out of treatment, as well.
Within a few days, we were up and running, making sure that deliveries were being made to those who were most in need, and that really could not have happened without the help of St. Vincent de Paul.
And I'm just so sometimes just moved and just the compassion and empathy for the work that we do and the people we get to work with and the organizations that benefit. It's just every day is just inspiring. Not every moment of every day is great, but when you really start to think about how many people are trying to lift up others, it's just awesome.